Today we are meeting with Jill Simmons, a dietitian at St. John Children's Hospital. She is here to speak with us on behalf of raising awareness for global childhood nutrition in honor of World Health Day.
On behalf of UNICEF, thank you so much for joining us today. Could you please introduce yourself and your role as a dietitian in St. John Hospital?
Yeah, thank you so much for having me. So it's actually perfect timing. We're recording this, it's still March, and March is National Nutrition Month, so this is a great timing. Like they said, I am a registered dietitian. I work at St. John and St. John Children's Hospital in Detroit. I'm the lead registered dietitian specialist there. I cover the pediatric unit, pediatric ICU, the neonatal ICU, and I also cover an adult ICU and an adult surgical step down unit. Before I started working in Detroit, I have worked a few other places, and I received my bachelor's in dietetics from Michigan State University and my master's from Loyola University in Chicago. I'm also an active board member on the Michigan Academy of Nutrition and Dietetics, where I'm the state policy representative.
Thank you. I know you mentioned all your different roles. Can you just give me a brief overview of the kind of work that you do for your organizations and what types of, if you do any research, can you elaborate on that?
So I work inpatient. So when you think of a hospital setting, if you were in the hospital or your child was in the hospital, I would be the one seeing you. My day is typically seeing consults. So if something comes up that's nutrition related, we become involved as a part of the interdisciplinary team. Other things that I do along with seeing patients is training resident physicians or training other students who are getting their degree in dietetics. And then a lot of interdisciplinary teamwork and communication, whether it's rounding with the medical team, talking with case management, or coordinating with an outpatient dietitian to see my patients once they leave the hospital.
That all sounds great. What problems within the field of health and nutrition does your work target the most?
Yeah, so in the acute inpatient setting, I'm dealing with a lot of, as I said, acute issues. So you're coming into the hospital for something that's gotten to the point where it's problematic. So a lot of times we're dealing with things that we need to tackle then and there. A lot of them can be prevented before coming to the hospital. Some of them are new onset issues that maybe the patient and their family didn't know about. A variety of things. I also am a certified clinical nutrition support provider. So if you are unable to eat when you're really sick, we make sure we're giving you nutrition, whether it's through a feeding tube or IV. I would be the one helping and involved in that sort of management. So again, just dealing with a lot of the acute issues that may or may not be able to be prevented before you come to the hospital.
Adding on to that point, how do you go addressing these specific problems, whether it's dealing with not eating and stuff like that?
Yeah, so that's a good question. A very important part of my job is, again, communicating with members of the healthcare team. So I work closely with nurses, with physicians, case managers, and of course, the patient is the center of our care as well as the family members. So if it's a child, often I'm working closely with the parent too. Also considering what resources I have available outside the hospital. It's very important to me that if this is a new problem or something that we can work on improving when the patient leaves the hospital, I want to set them up with what's available to help them be successful, be the healthiest version of themselves. So always being aware of who I can refer to and what other services are outside of the hospital.
In addition to the work you've already started and continue to do, what are your goals involving health and nutrition in the long term?
Yeah, so again, I'm seeing problems as they are being found in the hospital. I would love to see more dietitians involved outside of the hospital. We, don't have a lot of that available. In Michigan, we're 2 of 50 states where dietitians are not licensed. This does limit some of the care we can provide outside of the hospital because we aren't having as many resources available. I would love to see dietitians in every primary care office. We have nutritionists who work in the WIC setting, so expanding that, really focusing more on prevention so that I'm seeing less children and then adults coming into the hospital with these chronic conditions that could be prevented in that outpatient setting.
That sounds really good. So what kind of current issues and trends in the field of health and nutrition do you think that we as college students or the general public should be aware of?
Yeah, I think one thing that the data that has really come to show are those social determinants of health. So how we grow up, where we grow up, who we're growing up with, our education, food access. There's so many things that we can really be looking at that stem from that community level, prevention focus, and even policy level that trickles down to preventing a lot of those diagnoses that I see in the hospital: obesity, diabetes, and what's really coming to light, what conditions may even be related or have some correlation to COVID. Also, I'm very passionate about school-based health. So when I was in Chicago, it was really cool. There were dietitians who worked in some of those school-based healthcare centers. And I think getting dietitians more involved in schools would be great. We do have dietitians who work in like food service management roles to help with the school lunch program, but even having them in clinics and meeting with children at school or their parents would be great.
Yeah, those all sound like great initiatives. And I'm sure the pandemic has impacted your work in some form. So, how has the novel COVID-19 pandemic impacted the results you've seen from your research and work?
Yeah, so it's been about a year now that in the Detroit area we've really been impacted by this. I think really being creative with problem solving, learning how to work with the resources we have both in the hospital and outside of it. I've been going to work since COVID started, but a lot of people have been working from home, which decreases that face-to-face time that healthcare providers have with their patients. I know some dietitians have been doing more over Zoom to still keep up with their patients and making sure they're getting the care they need. But obviously it's not the same as meeting with someone in person. Just lifestyle changes in general, more screen time, less activity. People spending more time at home affects their emotional status, less social interaction, really just looking at health from a mental health perspective too. It's really come into play in so many aspects this last year.
Yeah, so adding on to that, are there any prevalent trends in nutritional health, especially in children, that you have seen come about with the rise of this COVID-19?
Yeah, so we're starting to see the effects of being home more often with COVID, social distancing. We have seen trends up in terms of childhood obesity, a lot of weight gain in the last year with screen time. Kids are at school less, playing with their friends outside less or at their homes. The school lunch program also has gotten to be very creative with ways to get those kids the food that they need to help with food security. But still, it's not the same as a kid being able to go to school and get those meals that they need, whether it's breakfast, lunch, snacks. I definitely appreciate the people who have been creative with helping out with that, but it's not quite the same. Also seeing that multi-system inflammatory syndrome in children and just any sort of inflammatory process that can increase their risk for developing malnutrition in that acute time frame. But also, studies will maybe come to show down the road if those acute episodes have any impact long term on growth and things. So that's what I would be most interested in. So really looking at how COVID has affected our mental health any acute issues and how it might down the road show any impact on long-term chronic disease development is very interesting to me.
Going forward, do you have any advice to give children right now, just so that they can get back to the sense of normalcy?
Yeah, I think parents have been superheroes this last year. They've not only been having to work either from home or still going to work themselves, but also parenting. I think that's great. It's definitely a challenge. I think anything anyone can do now that it's getting nicer outside, hopefully kids can be outside more. I know that schooling has been on the screen a lot, so that screen time that we really don't want to prevent them. As we see kids going back to school, I think foresee that getting better. But really just being mindful of those healthy eating habits too, offering healthier options when we can, and playing with friends when they're able to, playing with their parents if that's who they're home with, and just being mindful still of the safety requirements.
Just an additional question. I know a lot of people have kind of had some weight gain in response to the pandemic. I'm just kind of wondering if there should be any concern for individuals.
Yeah, it's always been a concern in the US. When you think about nutrition, I work with opposite ends of the spectrum, both malnutrition from an undernutrition standpoint and then overnutrition, which can still be a form of malnutrition depending on what nutrients we're getting in. I think that this is a acute on chronic condition we're going to be dealing with and for some time now, but may not see the full effects of how this last year has affected us right away. I think once people feel safe and comfortable going back to their primary care office, we'll start to see some real results of, how much weight gain we're seeing in patients. And just really, my take home message to them would be get outside and get active when you can, any sort of activity, even if you're just walking around your home, if you're working from home, and then being mindful of what you're eating and how much. So trying to add some color to your plate and really portion control if it's something that you're indulging in.
Kind of going off of that, have you observed any disparities in the quality of nutritional health between different cities or counties within the United States and even different countries if that's an interest of yours?
Yeah, so I think the data from that has really come to the forefront in this last year. So social determinants of health, like I've mentioned, that depending on where you live, could affect your health long term. Really focusing on policy that we can change as a nation to offer more healthful environments for our kids that grow up to be healthier adults. I did live and go to school in Chicago. So as I mentioned, just seeing the resources that are available in larger urban settings is definitely unique compared to those rural communities. Ideally, as we have in this past year gotten used to with the pandemic, telehealth and Zoom more, I'm hoping to see this trend kind of help out those communities, those more rural communities. Maybe these people can be reached better now that people are becoming more familiar with Zoom. They wouldn't be afraid to go on and have a phone call with their physician through telehealth, or hopefully in the future, maybe a dietitian, things like that, that we can just get creative and think about how we can reach those who are living in areas where they may not have the same resources.
Well, thank you so much. This was super informational, and I know we both learned a lot. Um, that is the end of our interview. I can stop the recording.